Marketing Ribond. This video section describes a few tools and techniques for promoting Ribond to dentists. Our most effective marketing tool is our website. Please direct dentists to our website at www.ribond.com. The Ribond website includes technique videos for periodontal splinting, single appointment bridges, and composite restorations. We also have a video that describes mechanisms in which fiber reinforcements work and compares Ribond to other fiber reinforcement materials. Demonstration materials. Manageability samples. These samples demonstrate Ribond's unique manageability characteristics. Ribond has virtually no memory and does not unravel when manipulated. These are not treated to bond and are not clinically usable. We put an ink mark on them to discourage clinical use. Models. We can provide a limited amount of models showing a Ribond bridge framework and a Ribond periodontal splint. We are trying to show the Ribond and therefore minimize the amount of the covering layer of composite on the Ribond. Clinical cases will have a thicker covering layer of flowable composite over the Ribond. Bridge model. The anterior bridge model is good for demonstrating Ribond's strength. Use the back of a pair of cotton pliers or other blunt instrument to apply pressure from the lingual side toward the facial. Do not push from the facial towards the lingual, as there is no bond on the composite to the stone model and the Ribond framework could come off. Brochures. Printed brochures are still available, although our website and videos offer much more detail. Hands-on demonstrations are a great way to show Ribond to dentists. We can provide pre-cut samples of Ribond and stone models for you to do these demonstrations. This video shows a hands-on demonstration of making a Ribond periodontal splint. Wet the Ribond with a drop of bonding resin and blot off the excess resin. In a clinical case, we would use a lint-free material like a patient's bib to blot off the excess resin, but for these hands-on demonstrations we can use a paper towel. Place a thin layer of a soft paste-like viscosity restorative composite on the model and flatten it with an instrument so that the composite resin is approximately half a millimeter thick. Starting at one end of the splint, hold the Ribond with metal pliers and press the wetted Ribond into the composite with your finger. Use your finger to press the Ribond through the composite resin so the Ribond is closely layered against the tooth. Hold the Ribond against the tooth with your finger while placing the Ribond into the interproximal contact with a thin-tipped spatula-style composite instrument. Repeat this process moving from one tooth to the next adjacent tooth until the entire piece of Ribond is placed against the teeth. If the Ribond piece is too long, before placing the Ribond against the last tooth, cut the Ribond with the special Ribond scissors that are included in the starter kit. If you're at a dental congress, after using the model, place it upside down to prevent light exposure and you can reuse it later to show a different dentist. When demonstrating Ribond to another dentist, remove part of the adapted Ribond and then show the process of placing the Ribond into the composite.